We are covering the critical topic of postpartum complications, an area heavily tested on the NCLEX. The most immediate and life-threatening complication is postpartum hemorrhage. The exam expects you to know the specific definitions of blood loss, which is over 500 milliliters for a vaginal birth and over 1,000 milliliters for a cesarean section. The primary cause, accounting for the vast majority of cases, is uterine atony. This is when the uterus fails to contract effectively after birth, leaving it feeling soft or boggy on palpation. An exam question will likely present a scenario, such as a client 4 hours postpartum who has saturated a perineal pad in under an hour. It will ask for your first nursing action. The options might include calling the provider, administering oxytocin, or assessing vital signs. However, the absolute priority is to immediately assess the uterine fundus. If it is boggy, your first intervention is to perform a firm fundal massage to stimulate contraction and control the bleeding. This is a foundational safety and priority question. Another trap involves differentiating the cause. If the fundus is firm but there's a steady trickle of bright red blood, you should suspect a cervical or vaginal laceration, not atony. To help you remember the main causes of postpartum hemorrhage, use the mnemonic of the 4 T's, which are tone for uterine atony, trauma for lacerations or hematomas, tissue for retained placental fragments, and thrombin for any coagulation disorders. Next, let's discuss postpartum infections, also known as puerperal sepsis. The NCLEX will test your ability to identify this based on key signs which include a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius on 2 separate occasions at least 24 hours after birth, along with foul-smelling lochia and uterine tenderness. A common exam trick is to present a client with a low-grade fever within the first 24 hours. This can be a normal finding due to labor-related dehydration, so the timing is critical for your assessment. Thromboembolic events are another significant risk due to the hypercoagulable state of pregnancy. A classic NCLEX scenario involves a postpartum client, especially one who had a C-section, complaining of unilateral calf pain, redness, and swelling. Your priority action is to instruct the client to remain on bed rest with the affected leg elevated and to notify the healthcare provider immediately. You must never massage the affected leg, as this could dislodge a clot, leading to a life-threatening pulmonary embolism. Finally, the exam will require you to differentiate between the postpartum blues and postpartum depression. The key is the timeline and functional impairment. Postpartum blues occur within the first 2 weeks, involve transient mood swings, and do not affect the mother's ability to care for her baby. Postpartum depression, however, persists for longer than 2 weeks and involves debilitating symptoms like feelings of hopelessness and an inability to bond with or care for the infant, requiring immediate intervention and referral. In cases of breastfeeding complications like mastitis, characterized by a painful red, wedge-shaped area on one breast and flu-like symptoms, the crucial exam-focused advice is to encourage the mother to continue breastfeeding or pumping from that side to promote drainage and resolve the infection.